Hi, I'm Danielle Roosevelt, registered dietitian and board certified health coach, and we're going to talk about exercise and diabetes. In today's video, we're going to talk about several topics related to exercise for diabetes. We're going to define what exercise is, we'll talk about types of exercise, and then finally talking about exercising safely. So, what is exercise? Exercise is specific, planned, intentional, and repetitive movement done for the purpose of conditioning the body and maintaining health and fitness. What is physical activity? Physical activity is any activity that gets the body moving and uses energy. This can include exercise, but also includes daily movements like raking leaves, doing household chores, or walking upstairs. Let's talk a little bit about the types of activity. So we're going to talk about 4 different types of physical activity. We're going to talk about aerobic, we're going to talk about muscle strengthening, we're going to talk about bone strengthening, and we're going to talk about stretching. Let's start with aerobic. Aerobic is good for your lungs, heart, and blood flow. It uses large muscle groups like those in your arms and legs, and your heart beats faster, you breathe heavier, and aerobic activity can help you develop lung strength and stamina. Examples of aerobic activity include running, swimming, and cycling. Muscle strengthening is good for gaining strength, power, and muscle endurance. Strengthening muscles can also help with your balance and can help you with everyday activities like lifting the kids and lifting the stroller, carrying shopping bags, pushing a vacuum or a lawnmower. Examples of muscle strengthening activity includes lifting weights, doing push-ups, or doing sit-ups. Bone strengthening movement creates impact that makes your bones stronger. Some examples include jumping jacks, running, or jumping rope. And finally, we have stretching. Stretching increases mobility in muscles and joints. It improves posture. It reduces stress, and it helps blood flow in the body just like aerobic exercise. Stretching can be done slowly by holding positions for a longer amount of time, or sometimes more quickly by holding a stretch for just a few seconds. Some good examples of stretching include yoga, standing stretches, and seated stretches. So let's talk a little bit about why exercise and physical activity are so important. We were meant to move. Our bodies were meant to move. We were not meant to be sedentary. And so a body that moves often thrives. And you may be thinking, isn't exercise just for people who want to gain big muscles or train for an event? Well, sure, exercise can be for that, but also exercise and physical activity have many, many internal and external benefits. 2 that we want to point out for people with diabetes are the effects on the cardiovascular system. So because people with diabetes tend to have a higher cardiovascular disease risk, exercise can play an important role in decreasing LDL or bad cholesterol and increasing HDL or good cholesterol. Not only does it help our cardiovascular system, but regular exercise for people with diabetes can help utilize blood sugar more efficiently and better. It helps our cells become more insulin sensitive, and it helps our body utilize blood sugar better. So more sugar in the cells means less sugar hanging out in the blood. So there are many, many, countless benefits of exercise for people with diabetes, but these are 2 that we really wanted to highlight. And utilizing more blood sugar as a result of exercise can mean that you may need less insulin or medication to keep your blood sugars under control on days when you exercise. Okay, so now you know what exercise is and what physical activity is, and you know why it's important. Let's talk about how much exercise you need. So we'll start with aerobic physical activity. The minimum amount that you need for health benefits is about 2.5 hours or 150 minutes of moderate intense physical activity per week. You're probably asking, what's moderate activity? Think about the talk test. If you can talk while performing physical activity but not sing, you're performing moderate intense physical activity. So it means that you're working hard enough that you can still carry on a conversation, but you couldn't belt out a show tune. That's how we know that it's moderate physical activity. We want you to move at least 3 times per week with no more than 2 days in a row of inactivity. It's also important to note that additional minutes of exercise per week, up to 300 minutes, gives additional benefits. So the more that you're exercising, the more benefit to your heart and to your lungs, to your blood sugar control, and also might be interested to know that 300 minutes of physical activity per week can help you maintain lost weight. So if you are in the process of losing weight, activity can help you keep off the weight that you've lost. And we start to see that benefit at about 7 hours or 300 minutes per week. Muscle strengthening. You want to perform muscle strengthening exercise at least 2 times a week for at least 20 minutes at a time, and choose exercises that work all major muscle groups like our chest, our back, our legs, our midsection. And if you're not sure where to start or you've never done muscle strengthening exercises before, you can certainly talk to your healthcare provider, or you may want to seek out a personal trainer that can help put together a routine for you. Finally, we want to incorporate stretching into our activity routines. Every time we're being active, we should be incorporating some stretching. So this is something that should be done daily. So now you know what exercise is, you know how much you should get. Let's talk about how to get started safely. You always want to start with a discussion with your healthcare provider anytime you're going to begin an exercise routine. Start with that discussion. Especially for people with diabetes, you may be asked to adjust your eating plan or adjust your medication to make sure your numbers are on target. You may need to get your eyes, heart, kidney, or nerves tested to make sure that the exercise that you plan on doing is right for your particular condition. And when exercising, listen to your body. Warm up before physical activity, cool down after activity, and make sure that you have a snack or an oral glucose supplement on hand when exercising. So how do you go about choosing physical activity and exercise that you want to engage in? So what are some things to consider? The first, really, and the priority here is to choose activities that you enjoy and activities that you can do most of the time. So if you don't enjoy what you're doing, you're probably not going to keep up with that routine. So choose an activity that you enjoy. Choose an activity that you think you can do most of the time and be consistent with. Start small and build your routine over time. Sometimes when we are embarking on exercise, we just want to jump into as much activity as possible, and we set goals of being active every day of the week and doing super intense exercises. But really what we found is start small and build your exercise routine. Not only does that help you build your endurance, it helps you avoid injury, and it also prevents you being so sore that you don't want to do it anymore. So start small and build your routine over time. And remember, you don't need expensive equipment or gym memberships in order to be active. So this slide shows us a little bit about some exercise options that require no equipment and some that need minimal equipment. So if we're looking at the no equipment needed, walking, jogging, running, body weight exercises. So we talked about muscle strengthening exercises, and body weight exercises can fit in that category. Push-ups, sit-ups, squats. So you can, body weight exercises require no equipment but your body. Yoga, Tai Chi, stretching, chair exercises, all of these require no equipment. And then we have some that do require equipment, but these might be things that you already have access to, like a bicycle for cycling, or maybe you have a community pool where you can swim, or weightlifting or muscle strengthening. So you may have dumbbells in the house, you may have resistance bands, and a lot of these can be fairly low cost to get equipment to be able to perform some muscle strengthening exercises. So again, you don't need a gym membership and you don't need expensive equipment to be able to exercise. Here's a couple additional things to think about when you're considering what type of activity you want to engage in. Remember to not overlook walking. Walking at a brisk pace fits in that moderate intense physical activity. It's safe for the body, it's free, and you can do it practically anywhere, even in your own home. You might want more vigorous activity like jogging and running. Just keep in mind that jogging and running can be a bit tougher on the joints. And so if that is an issue for you, it's just something to consider. Regardless of what type of activity you choose, invest in good exercise shoes. So whether that's walking or running or hiking or biking, invest in good shoes. And a couple notes about getting good exercise shoes. Do make sure that you try them on in the afternoon. Your feet tend to be a little bit bigger in the afternoon, so you'll get more of an accurate size. And make sure that you try on your shoes with the socks that you plan on wearing when you're exercising. That's very important because you want to make sure that you're getting the right fit for what you'll be wearing at the time when you're exercising. And then finally, please keep in mind the benefits of muscle strengthening exercises. Oftentimes when we're embarking on exercise, we tend to think just about cardio, like walking or running or biking. Remember that muscle building has tremendous benefits in helping us build or preserve our lean muscle mass. That can help us prevent injuries. It can help increase the insulin sensitivity of our bodies, and it also can help with things like fat loss and utilizing blood sugar more efficiently, even between workouts. So remember, muscle strengthening has great benefits, and make sure that you're thinking about including it in your routine. So what about managing blood sugar during exercise? There are definitely a few things to consider here. Remember that low blood sugar can happen during or even after exercise. And low blood sugar is most common in people with diabetes who take insulin and don't eat enough carbohydrate. While it can happen with people with type 2 diabetes, not treated with insulin, it's definitely not as common. So remember that low blood sugar can happen during or even after exercise. But on the reverse of that, some people may experience high blood sugar. They may get ketones, or they may even experience ketoacidosis during or around exercise. So make sure that you're checking your blood sugar before and after your workouts to avoid both highs and lows. So additional things to consider with blood sugar management during exercise. So for all people with diabetes, increase your water before, during, and after exercise. So make sure you're hydrating well. Measure your blood sugar before, during, and after. I know that seems like a lot of checking, but when you're first embarking on a exercise or a physical activity routine, you may not know how it's going to affect you. And the best way to find out is really through tracking how you're moving and tracking those blood sugars before, during, and after. So check your blood sugar, but also write it down. And use the 15-15 rule if your blood sugar is less than 100 milligrams per deciliter. Are you wondering what is the 15-15 rule? Don't worry, we're going to get to that in just a few minutes. If you feel symptoms of low blood sugar during your activity, stop immediately. Don't think to yourself, oh, I only have one set left, or I only have 5 minutes more in this walk or run. Really, stop immediately and check your blood sugar, okay? If you're on insulin, you may be asked to decrease the insulin dose that affects the time period of your exercise. So what we mean by that is if you exercise in the morning, you may be asked to reduce your insulin dose in the morning to account for the fact that you're going to be moving more. And oftentimes that's about a decrease of 30%. This is really important for long duration exercise, 60 minutes or longer. So again, talk with your healthcare provider about any adjustments you need in insulin on the days where you're going to be exercising. It may also be helpful to inject insulin in a site other than the one being used during exercise. So for instance, if you're going to be doing arm exercises like shoulder presses or chest presses, or you're going to be playing racquetball, it may benefit you to inject insulin into the stomach or the thigh as opposed to the arm on the day when you're going to be playing arm-heavy sports or engaging in arm-heavy exercises. Okay, so now let's talk about the 15-15 rule. You want to make sure you're checking your blood sugar before you start to exercise. If your blood sugar is less than 100 milligrams per deciliter, take 15 to 20 grams of carbohydrate to raise your blood sugar. So this is either 4 glucose tabs or 1 glucose gel tube or 4 ounces of juice or regular soda, not diet soda, or 1 tablespoon of sugar or honey. Check your blood sugar after 15 minutes, and if it's still low, take another 15 grams of carbohydrate. Repeat this process as needed until your blood sugar is at least 100 milligrams per deciliter. This is a really important rule, and I want to point out a few things that are important here. First, take 15 to 20 grams of carbohydrate. Your instinct may be to take more, but take 15 grams, and that's why having 4 glucose tabs or a glucose gel tube at the ready is really helpful, because that way it's pre-portioned for you and you know you're just getting 15 grams. You're going to probably want to take more, but don't. Take just 15 grams, wait 15 minutes, and then check your blood sugar. You'll also notice that what we've recommended for glucose replacement are all fast-acting, sugar-based carbohydrates. And that is important because we want it to act quickly. We want it to bring your blood sugar up quickly. So notice that there's no fiber in any of these, no fat, and no protein. And it's like that for a reason. So taking quick-acting carbohydrate and taking 15 grams, then waiting 15 minutes and checking again is the best and right process for when you are under 100 milligrams per deciliter at the beginning of your exercise or any point during your exercise. So those are really important facts to remember. Take just 15 grams and then wait 15 minutes and check again. And be sure that you're taking quick-acting carbohydrate, so things that do not include fiber, protein, or fat. A few additional precautions that we want to mention: always talk to your healthcare provider before starting a new exercise routine. We've mentioned that before, and we'll say it again here. Talk to your healthcare provider before starting a new exercise routine. But if you have, in particular, numb feet, you might need to limit weight-bearing exercises. So you want to take extra care and protection for your feet. So you might engage in more maybe cycling or seated exercises. And when you do exercise, make sure you're wearing the right shoes and socks, you're performing a brief foot exam, so that you're really taking care of your feet. If you have nerve damage to your heart or your lungs, you may want to avoid aerobic activities that can affect heart rate and your blood pressure control. If you have eye damage, you want to limit the types of activities that would build up pressure in the eyes. So exercises like swimming, walking, or low impact aerobics may be better for those who have eye damage versus things like racquetball, tennis, or even playing strenuous wind instruments. If you have high blood pressure or heart disease, walking or swimming might be your safest options. Exercises like planks or wall sits or isometric exercises may not be the best for you. And if you're on dialysis or you have an organ transplant, it's really important to talk to your healthcare provider before starting a new exercise routine. And you may really need to start off very slowly, and that's okay and expected. So, in summary, consult your healthcare provider before starting an exercise routine. Get a mix of aerobic, muscle strengthening, bone strengthening, and stretching exercises. And mainly, find an activity that you enjoy. You are more likely to stick with it if you find something that you really enjoy. Thanks so much for listening. I'm Danielle Hoosevelt, registered dietitian and health coach, and this was Diabetes and Exercise.